When I went to work for the pharmaceutical consulting firm, we did a lot of evaluations of products. There were probably about 10 countries that were listed as wealthy countries, and that's where the majority of the sales were. The other 180 or so were listed in a column called Rest of World, and the sales for Rest of World were very, very small. And that's where this gnawing about injustice came, and I started to go, wow, what could I do?
I got part of my education abroad. It was very hard for me to realize how their doctors help their patients, and I am not able to do that here in Armenia.
It's medical and social injustice. You know, how can you sit here in the United States knowing that there are life-changing and life-saving medications available, but they're not available to the majority of the world? And therefore, we started a for-profit company called OWP Pharmaceuticals, selling epilepsy medications. At the same time, we created a synergistic company called ROW Foundation, which is a not-for-profit corporation, which was a significant partner in OWP, and therefore a steady stream of profits from OWP would flow automatically into ROW to fund good works around the world.
Our children are the same children, but they have no possibilities because they were born in this poor country, and this is very difficult. For us, for doctors, this is very difficult to stop at some point when you know that there is a solution.
January 19, 2012, he had the first seizure at night. We took him to the hospital and stayed there for 3 days, and by that time he had 30 seizures.
We had very many discussions with different epilepsy experts, and all of them agreed that the first thing we have to have is a good video EEG monitoring unit. Without that, there is no chance to start surgery.
The doctors, they were saying, why are you upset? Epilepsy is just a way of living. Take it as it is, it's okay. I didn't know what to do, I didn't know what to say. I was just holding him and I was telling him that it's gonna be over. But when strong seizure was happening, he shouted, "Mom!" I can still hear that voice.
And there'd been so much work that myself and our team had done to get to the point where we could make a donation. And the reality that this model that we'd worked on so long was having its first impact was exhilarating. And to know that we're going to change the lives of patients in Armenia through the donation of this video EEG machine was priceless.
Benjamin, one of those kids, with the help of video EEG machine, we were able to remove this abnormal, pathological brain tissue, and Benjamin is cured now. Benjamin doesn't have epilepsy anymore.
This VEG machine changed my son's life. I remember my doctor's happy face when she said that we have a new machine and we have a new hope. It's like she's saying, we have a new hope. It's great.